Dr. Warren has spent a considerable amount of time talking about the data and the numbers of children with special needs here in the state of Tennessee, so I'm just going to talk more on the program, what the program does, and how to actually refer children to this program. So our objectives are to increase your awareness of the program, to outline the service provision and coverage of the CSS program, and also to try to continue to foster that collaboration between public health and private providers. So what is CSS, or Children's Special Services? It's the state's Title V program for children and youth with special health care needs, and as Dr. Warren stated, it is funded through our federal maternal and child health block grant. And I don't want to belabor the history this morning. However, when we're in the community, a lot of time providers say they have never heard of this program. And those of us that work with the program are kind of shocked because it's been around such a long time. But as I was sharing this morning with Becky, the docs that were around when this program started are no longer here. Or if they are, they're retired. And so there is a lack of knowledge in some cases about the program. So that's what we want to do. We want to educate you on what the program is and why we're here. So this program actually started in 1919 in Memphis as the Crippled Children's Services, or Crippled Children's Hospital. And at that time, it was strictly for orthopedic diagnosis. And from there, the state actually passed legislation in 1929 that became the Crippled Children's Act. And parts of that legislation is still current in our legislative statute today. So in 1931 through 1934, the program ceased to function because of the Depression. There was no funding available, and therefore families were not being seen at that time. And it was not until 1935 that the federal funding became appropriated in the Social Security Administration Act, and funding became available in 1936 and has continued through this day. So our first screening program started just for speech and hearing defects, and that was in 1951, and that's still being done now in our speech and hearing, or our newborn screening section of the department. There are, in 1953, limited services were added that included speech and hearing for the indigent population, but it was a separate program. So while we screened in the Crippled Children's program, the actual services were provided in a different program. And then in 1961, legislation was revised and broadened, and the definition included chronic conditions. And 1988, we began to provide care coordination in 3 areas of the state, and that has expanded and is now a statewide component of the CSS program. So in 1988, most of our referrals were made through the pediatric clinics that were part of the health department. Well, we no longer offer pediatric clinics in most of the health departments, so we rely now on referrals from the public, from private providers. In 1989, speech and hearing were combined with Crippled Children's Services, and it formed our current program of Children's Special Services, and we had the program and care coordination services were provided statewide for the program. So eligibility for the program, any child with a physical disability who is under the age of 21, one who is deemed to have a physical disability by any reason, whether congenital or acquired as a result of an accident or disease, one that requires medical, surgical, or dental treatment and rehabilitation, and one who may be or is totally incapacitated for the receipt of a normal education. And our definition is somewhat different from the federal definition because the state of Tennessee limits to physical chronic medical conditions only, and those are conditions that the child has been diagnosed with, whereas the federal definition indicates if they are at risk, and it could be for physical or behavioral or mental diagnosis, so it's not limited just to physical. This definition does not include those children whose sole diagnosis is blindness or deafness. So if a child is totally blind or totally deaf, then they're not eligible for services through this program. However, if they have a vision loss or hearing loss, then they are eligible. Nor does the definition include children who are diagnosed as psychotic. This definition does not prohibit services for children with some acute conditions such as fractures, burns, and osteomyelitis. So while we say it's for chronic physical conditions, we are able to offer services for some conditions that are considered to be acute. And of course, participants must be a resident of the state, and the income must be at or below 200% of the federal poverty level. And you have in your packet a copy of this PowerPoint, which will give you the current poverty level. This changes each year in February, and we change our notice in March, so it normally goes up a few dollars every year. So the CSS program is a two-pronged program. We offer care coordination and medical services, and care coordination is just a form of case management for special needs children that promotes the effective and efficient organization and utilization of resources to assure necessary comprehensive services for children with those special needs. And then, of course, medical services, we are able to reimburse for medical, surgical, rehabilitative treatment for conditions related to an approved diagnosis. And different agencies or different entities provide different definitions for case management. For care coordination in the state, for the public health sector, these are some of the type services that we provide. So it's not necessarily a standardized definition at this point, it's just the type of services that we provide. So of course, as I said, this program is considered to be a payer of last resort. We help families with securing payment for services that they may have received through other payment sources, such as their insurance companies. We help them to actually apply for insurance and to receive insurance. And if they are denied services, we help them with appeals to secure insurance payment. We provide and receive referrals from TEIS and also participate in multidisciplinary team meetings through the local school system, and also participate with individual family service plan meetings through TEIS. We provide support services and assist families to access medical and non-medical services for participation in activities of daily living, and also collaborate with the MCO provider offices and other agencies to make sure that those services necessary are received. Most of the care coordinators, and I'm sure all of those that you met and interacted with yesterday, can give you a wide variety of community resources that are in their area. They often make referrals to those resources. And we also assist in developing a transition plan for all participants that are over the age of 14 for transition to adulthood, and that includes both medical and non-medical needs. And for medical services, I'm not sure if Dr. Hall is here today, but Dr. Hall presented to our staff on Thursday, and he had a list of services that he found that most children who have medical complex needs had no payment source for, and we didn't get an opportunity to talk after he presented, but those were the kinds of services that this program will pay for. So some of our covered services include payments for diagnostic screening, testing, evaluations, and treatment, for therapies including occupational, speech, or physical. We cover surgeries, whether they be inpatient or outpatient, hospital stays, office visits for primary care or specialty visits, as well as prescription drugs. We provide durable medical equipment or assistive technology, augmentative communication devices, pay for supplies such as for diabetic supplies, tube feedings, diapers, hearing aids, batteries, molds, etc., rehabilitative services, special foods and formula, and also we assist with co-pays, co-insurance, and deductibles. So for the calendar year 2013, the CSS program provided services for over 540 different diagnoses, and it's often been said, or I've heard it say, long as I've been in the program, that we have provided services for over 15,000 diagnoses. So we have a list of eligible diagnoses, but that list is not all inclusive, and so we base our decision on that child's diagnosis. So for this past year, our most common diagnoses were for, and these are listed in the order from the highest to the least. So our most common diagnosis was for hearing loss, cardiac-related diagnosis, seizure disorders, asthma, cerebral palsy, diabetes, cystic fibrosis, esophageal reflux, obesity, and it has to be greater than the 95th percentile, congenital hydrocephalus, and sickle cell. So for some Tennessee statistics just on the CSS program, this is not statewide data, just for the CSS program through the Department of Health. we provided services for 2,983 children, and this is current data as of March the 21st. And then, so we wanted to compare, looking at the number of children that we provide services for as to the number of pediatric providers that are here in the state. And for those that were listed on the Board of Licensure website that were either full-time or part-time providers with active practices, there were over 1,500 providers, well, right at 1,600 providers for pediatric services. And when you look at that, just if you look at the numbers themselves, you think, well, for every 2 children, there's 1 provider in this state. But when you look at that data as it breaks down on the map, it doesn't always look that way. And I guess I just want to bring an awareness about the program. And so I know that every provider here has more than 1 child with a special need, or more than 2 children with a special need on their that they see in their practice. And if we could refer more children to the CSS program, there's a need there that we could help those families to meet. And this map, it just kind of talks about the number of children, so that's broken out by color as to the number of children on the CSS. Again, I'm talking about on the CSS program or that receive services through the CSS program, and then the number of providers in each of those counties. And it's kind of hard to see, of course, on the handout that you have, but if you look at the larger metropolitan areas like Shelby County over there, so Shelby County has 488 children that are on the CSS program there, and they have 300, I think that's, if I can see it correctly, 300 providers, or about 300 providers. Same thing with Knox. Knox has 129 providers and has close to 200 children on the program. So, but you see the areas that have no color and have 0, there are no children there that are receiving services through the CSS program, but then there are also no pediatric providers there. And we have the numbers, the actual numbers, so if you're interested in that information, we can get that information to you by specific county. I wanted to include our regional CSS contact information so that for the counties that you provide services for, you would have a contact person. And this information is not currently on our website, but we plan to put it on the website so that if you have a question, we recently relaunched our website for children and youth with special healthcare needs, where we added the electronic resource directory. We also have added information for providers who want to become vendors for this program. And just while I'm here, I would like to make a plea. This program, by state statute, has to have an advisory committee that is made up of 7 pediatric providers and 1 parent consultant or 1 parent family member. And so we are in the process of recruiting 5 providers or 5 medical doctors. And I think we have 2 vacancies that are going to be occurring in East Tennessee, 2 vacancies here in the Middle Tennessee region, and then there's also a position, I want to say, in West Tennessee. However, if you're interested in serving with the program, I know our nurse consultant here has talked to a couple of people, and we had people yesterday talking to a couple of providers. We really would like to encourage you to make contact with our office and talk to us about helping. That committee actually helps to make decisions about the CSS program. It helps to that committee looks at the diagnosis that we provide service for and makes sure that we are meeting those needs of the children or those diagnoses that you most commonly see, and helps us to outline what kind of services we actually provide. And so for opportunities for collaboration, the Children's Special Services wants to collaborate with you as the pediatric provider, as well as our families and our children. And I always, with my former presentations, always ended everything with team, everyone achieves more. But Dr. Warren helped me kind of pull that team together as to who we're really talking about. So I just want to leave that with you, as this is why we're here, just to make sure that we kind of provide a more collaborative effort to provide services for children. And that's our contact information. And again, on the table out front, we actually left a flyer. We have just redeveloped our professional fact sheet, and once they are printed, we will be sending those out to you. But if you would take a flyer, it just kind of gives you some brief information on what type services the program offers.